Hello, future doctors. I welcome back you all in our fantastic journey towards mastering toxicology. Before starting the lecture, I sincerely want to apologize for not uploading the lectures, as past few months have been a very hectic schedule for me. But now I will try to upload the video continuously and on regular basis. So without any ado, let's start today's lecture. Today's lecture is gonna be on metallic poisoning. In this, we are going to study the poisoning of the heavy metals. In this, we are going to study arsenic, lead, mercury, etc. etc. So, we cannot cover these all in one particular video, so we have to make different videos for that. If I'll try to complete arsenic today in this lecture, then tomorrow I'll upload the video on lead and then on the mercury poison. Now let's start the discussion about the arsenic poisoning. Arsenic is a heavy metal. What is so special about arsenic poisoning? Arsenic poisoning is the most common acute heavy poisoning. Common acute heavy metal poisoning. This is the most common acute heavy metal poisoning that occurs in our society. Now we have to understand particularly the forms of arsenic that are poisonous. The metallic or the natural form of arsenic is not toxic. That is the elemental form of arsenic. Elemental form is not toxic as it is not absorbed from our alimentary canal. Only toxic form of arsenics are its inorganic salts. Every inorganic salt of arsenic is toxic. For example, arsenic trioxide. This is one of the most toxic substance of the or toxic salt of the arsenic. Arsenic trioxide. It's one of the most toxic salt of arsenic. Let me correct my sentence. It's one of the most toxic salt form. The most toxic form of the arsenic is arsenine. It's a gaseous compound. It's a gaseous compound which is the most toxic form of arsenic. As we have learned the toxic forms, now we are going to study about the mechanism of action. How does the arsenic affects the body? So its mechanism of action is very simple. How it's simple? It interferes with cellular respiration. It interferes with the cellular respiration. How does it interfere? It interferes by arsenic combines with sulfhydryl group of enzymes. It combines with sulfhydryl groups of enzymes, especially in mitochondria, and it affects the interface, the cellular respiration. This is the mechanism of action on how arsenic interfaces with the cellular respiration. As it has combined with the sulfhydryl group, the enzyme is no longer in use. So the enzyme cannot be used longer in cellular respiration. So this is the are the mechanism of action. Now we are going to study about the signs and symptoms. Then how can we identify it's an arsenic poison or not? What are the signs the person will show, the body will show if its body is undergone the arsenic poison? The signs and symptoms of arsenic poisoning depends upon the doses. It depends upon doses. How does it depends upon doses? First is the fumiglant type. What is fulminant type? When a massive dose of arsenic is administered, it causes death, direct death. In 1 to 3 hours, the person will die immediately due to vascular shock, as the arsenic causes increase in vascular permeability. The arsenic causes increased vascular permeability that can lead to edema, and massive dose of arsenic can cause hypovolemic shock, and the person can die within 1 to 3 hours of that. What does massive dose means? That is 3 to 5 grams of arsenic. It is considered as a massive dose, and this is the fulminant types of arsenic poisoning. Second type of arsenic poisoning is acute arsenic poisoning, or also known as gastroenteric arsenic poisoning. It occurs when the arsenic is consumed in a small dose, that is 100 to 200 milligram, and it affects whole body. So we are going to study these signs and symptoms system wise. First of all, we are going to start up from the CNS. It causes headache, vertigo, hypothermia, tremor, and one of the most important CNS malfunction or CNS sign is it causes peripheral sensory nerve neuropathy. It causes peripheral neuropathy, majorly of sensory neurons. Next system we are going to study is the CVS. In CVS, it causes increased vascular permeability, as already mentioned. So because of that, edema and hemorrhages can also occur. Ventricular tachycardia and so more. The next system that we are going to study is renal system, that is our excretory system. In renal system, it can cause oliguria, uremia, and even in the urine we can find the traces of arsenic. So we can use it as a laboratory diagnosis to detect arsenic poisoning. Now, one of the most important that we have to study or that we have to mind is gastrointestinal system, that it causes symptoms that are similar to cholera. Cholera, that loose stools, throat pain, vomiting, these all symptoms occurs in cholera and as well as in arsenic poisoning. So these were the signs of acute arsenic poisoning. Now we will discuss much detail about the chronic arsenic poisoning. What is chronic arsenic poisoning? When we can call an arsenic poisoning chronic? Chronic arsenic poisoning is also known as arsenicosis. The chronic arsenic poisoning can be accidental, that is from either from occupational disorder hazards or occupational exposure, or an homicidal exposure, as well as homicidal. Arsenic poisoning can be called chronic when the small doses of arsenic is ingested or inhaled or administered in for very long time. So the words itself tells it's chronic, and the definition itself tells it's chronic. So the signs and symptom will be severe. So what are the signs of the chronic arsenic poisoning? First of all, in CNS, It causes polyneuritis. It causes fully degeneration of the nerves and hence also causes anesthesia. In skin, it causes hyperpigmentation, which causes uh, an appearance of like raindrop appearance, which resembles raindrop pigment. So it is also known as raindrop pigmentation. And this is a trademark sign of arsenic poisoning. This is very, very, very important to identify the arsenic poisoning. In skin, we can also see bilateral hyperkeratosis. In nails, we can see an bluish or whitish color line, which is also known as Aldrich Mees line. What does Eldritch Mees line suggest is if this is a nail, then there will be a whitish color line appearance on the nail. This is known as Eldritch Mees line. It is not specific only for arsenic. We will study this also in thallium poisoning. So this is not an trademark sign or a particular thing that can only appear in arsenic poisoning. In GIT also, it causes severe things like jaundice, cirrhosis of liver, hepatomegaly, and much more. One of the most important signs of chronic lead poisoning is anemia. How does it cause anemia? It causes bone marrow suppression. Arsenic chronic poisoning causes suppression of the bone marrow and hence causes anemia. So these were the signs and symptoms of the arsenic poisoning. Now we are going to study about the post-mortem appearance. Post-mortem appearance will show the red velvety and hemorrhagic stomach. The liver can be jaundiced and even severely necrosized. One of the most important point to be noted in arsenic poisoning is it delays putrefaction of the body. After studying everything about the arsenic poisoning, now we are going to study about the treatment, how to treat an arsenic poisoning case. First of all, emetics are the things that can induce vomitings are not at all prescribable. After that, gastric lavage is done to clear out the remaining arsenic and iron residue. Iron and arsenic from the stomach. After that, the antidote and the chelating agents are given. What chelating agents are given in the cases of arsenic poisoning is BAL, that is British anti-leucite, and DMSA, that is Mercapto succinic acid. These chelating agents are used to treat the arsenic poisoning. Those actually the chelating agents helps in treating the arsenic poisoning. These chelating agents binds with toxic form of arsenic and forms insoluble salts or compounds. These chelating agents with arsenic cause forms insoluble salts and compounds. Then they are excreted in urine. So by formation of the insoluble salts and compounds, the chelating agents helps in eliminating the arsenic. I know these signs and symptoms are very hard to learn and very difficult to remember. To learn this, I have already uploaded a mnemonic to learn the symptoms of arsenic poisoning. Please do watch that. That video link will be in description. That's all you have to learn about the arsenic poisoning. Thank you very much. Have a nice day.